The reason we invited you all here today is just to help answer some questions that we've received from the staff at Wichita Public Schools in regards to how we can communicate with them when we do have a case of a positive COVID, either staff member or somebody who's been in and around our buildings. We've created a process, kind of a flow chart, a lot like the charts that you see throughout the nation in regards to communication. And we're going to focus on two things. The most important is getting that information to the close contacts. That's letting the close contacts know that they've been in that close contact with somebody who's reported positive. We're going to work with our student support department, which is our nurses, and the Sedgwick County Health Department to determine who those close contacts are and then let them know that they are a close contact. The second piece of information is one that's more general, and that's to let everybody know that works in a certain building, a school, or even a structure like here at our school service center. Let everybody know that someone who works in that building has been tested and been determined to be positive for COVID. So those are the two things that we're going to do to answer some of the questions that we've received, especially from you and the media, in regards to letting staff know about positive COVID cases. I'll be happy to answer any questions that you have.
For students, do you guys have a method? I know I talked to some other districts where they're having seating charts so that they can get those close contacts. Do you have anything like that implemented as of now?
Yes, that is still, we'll wave at him as he goes by. To answer your question about students, that is still a work in progress because so many things regarding COVID are a moving target. But yes, we are looking at seating charts, we're looking at group cohorts so that we know what students are together. We've talked to you already about our visitor management system, where we're using our current visitor management system to track who goes into our building. So we will even have that information. Say one of you would want to go into our building. We would know that you had been in our building, and if there was a positive case, then we could look back and do that contact tracing as well.
So if a student does come into contact with someone who is COVID positive, would you get a phone call, letter, email? How would that system, or is it still in the works?
First of all, they'd have to be determined to be a close contact. And then we would use mostly email. However, we know with some of our students, that's not the best line of communication. With staff, we're going to focus on email because we know that is the best way. We've talked to staff and they've told us that's the best way to get information to us. With students, we know that we have to use a variety of communication forms in order to contact someone.
Earlier today, the district confirmed that there were positive cases at 3 of the schools. I'm guessing that's staff or teachers. Can you elaborate on those cases, maybe how many, who they are, and all of that?
No, I can't. For HIPAA reasons, we are giving out just that information that you have.
Could you confirm that information that you released earlier? Which schools have it?
Yes, we have confirmed cases at Curtis, Sowers, and Cessna. Sorry.
And then can you kind of just touch on, this situation, there's going to be, at every school, probably a COVID-19 case. Can you kind of just let parents know that this is an evolving situation?
What we've said since, I think what the government has said, what everybody has said since March, it's not if, it's when. And this is a prime example of that. Every time we've brought more people back to work, we've seen more incidents where people have had to be tested because of maybe they had a close contact at home. We've seen more incidences of isolation because they've traveled out of town, and now we're seeing more incidences of positive COVID cases. Again, we're bringing more people together, and the science would tell you you're going to have more cases because of that. What we're emphasizing to everybody is if they follow our safety procedures, follow the procedures that we've been told by the CDC, everybody else, wear masks, do your best to social distance so you are not a close contact, follow the guidelines. If you're feeling ill, stay home. We want to reduce as much as possible that incidence of close contact.
You aren't going to be releasing how
I do not. No, I do not.
Okay.
And right now we're in a good spot where there is 2 weeks for these teachers to quarantine if this were in the school year. Talk about that challenge and the challenge to fill their positions with substitutes.
We face that challenge every year. And anybody who's worked through a school year through the flu season, that challenge exists. And like so many things with COVID, that challenge plus more stress on the system. So certainly we need all of our substitutes to be willing and available. We know a lot of them are. We need the flexibility of staff to work through situations. Hopefully the split of in-school students and my school remote plus the virtual learning will give us the flexibility we need to move teachers from spot to spot. Because even a quarantined staff member, as we've learned over the summer, can provide services remotely. Not everybody can, but certainly some people are able to.
Do you know how many staff members are in quarantine right now?
I do not know.
Have you sort of monitored some of these other situations with some other schools that have already started, like the cases in Georgia and Mississippi, kind of use those as a bit of a learning example for you all? Are you paying attention to some of the other cases and places that have already started?
Absolutely. Most of our professionals have professional work groups where they have communication circles. Some that we've gotten a lot of plans from a lot of other districts. We get information from other districts, both within Kansas and outside of Kansas. Those folks are very good at telling us, hey, this worked really well. We tried that and we weren't so successful. And so one of the things I tell people, we've done more research since March probably than any this school district has ever done in its history, but it's constantly changing. You can't sit on your laurels and say the answer that we had yesterday is going to work tomorrow, because it may possibly change. And that's what we're doing by talking to our peers, talking to the professionals, talking to the doctors, the nurses, the Kansas State Department of Education, just looking at our options and what we have and trying to make the best fit for here in Wichita.
Does USD 259 plan to follow the state's grading criteria?
I think that's a situation that's in process. We created our own criteria. We know that the Kansas State Department of Education has criteria. We know there's a lot of other criteria that are out there. They're all similar in that they generally use some kind of a colored coding sheet with a low incidence, moderate, and high incidence. Some have different ones in there. And our board is in the process of looking at which one of those criteria are best for them to use when they make the final decision, or the most current decision in regards to whether we keep children in school or go fully remote.
In
Yes.
the next 2 weeks, if you have one of those areas where you have teachers that have already gotten it, turns into a hotspot, would you possibly look at delaying the start of school for students?
Absolutely. That's always been on the agenda for the board. We've always said we have to have the ability to pivot. We have made decisions all summer long, and then we've had to adapt those decisions. And I think you've seen that on a nationwide basis, you've seen it on a state basis, and you see it on a local basis. I think that shows that the communities are paying attention to the science. As the science changes and the information changes, how we respond, we have to change as well.
Is there anything that you'd like to say?
No, I think I will emphasize what Dr. Thompson says at the beginning or end of almost every single school board, and that is grace and patience. This is a very complicated situation. Our ultimate goal is to provide the best education possible to our students here in Wichita. We have to do that safely. It is one of our primary goals. But education and safety have to both be considered, and as how do we do it the best for our community.